Hello there, I'm Julie, and today we'll be talking about how important it is for families to communicate honestly and openly through difficult medical times. This is the Benchmark Brain Death Scenario presentation, and my name is Julie Zacharias. Next slide, please. Today's objectives, we will be discussing the medical care issues, applicable laws and regulations, interpretation of laws and regulations when making a decision, ethical issues, implementation of supporting policies and procedures, and policy and procedure coordinate consideration. These major objectives today will help us to understand the ethical and legal concerns that surround uh, medical treatment, as well as how to successfully put supporting policies and procedures into place. Attendees are going to leave this presentation with the skills and information needed to handle these difficult situations with compassion and integrity. Next slide, please. In this slide, we will be discussing the medical care issue. This is it regarding a patient who is presently in critical condition, has suffered significant brain damage, and is intubated to maintain life support. One of the other issues is the family's varying opinions on available treatments are making matters more complicated, and the medical staff is worried about the patient's prospects of surviving without life support. For the patient to receive the greatest care possible, it is imperative that all parties involved reach a consensus. It is important for medical and nursing staff to communicate openly with the family and each other to address any concerns or conflicts that may arise. For example, critical care nurses face significant challenges in providing high quality care due to important decisions, stressful situations, ethical dilemmas, as well as physical and psychological pressures. Also, maintaining a supportive and collaborative relationship with the patient's family can help to ensure that the best possible care is being provided. In this case, also something similar, post resuscitation care requires teamwork, coordination, and collaboration among healthcare providers to provide the highest quality care based on complex pathophysiological processes before, during, and after cardiac arrest. It is crucial for these providers to continuously update their knowledge and skills to effectively address evolving needs of patients in critical conditions. Commonly face challenges facing the critical care nurses is the including poor teamwork, lack of support, time pressure, limited resources, and ineffective training leading to occupational and stress burnout, causing many to consider leaving the intensive care units at hospitals. To combat these challenges, organizations must prioritize the well being of their critical care nurses and medical teams by providing adequate support, resources, and training opportunities. By addressing these issues and investing in the professional development, healthcare facilities can improve patient outcomes and retention rates within their intensive care units. Next slide, please. Applicable laws and regulations. In this slide, as you can see, the Arizona State Legislature's Title 14, Chapter 11, Article 7 states complete brain death is defined as the irreversible cessation of all functions of the entire brain, including the brainstem, because it lays out the standards for judging death in line with recognized medical standards. This legal definition is essential for healthcare professionals in this scenario to comprehend when making decisions about end of life care. Um, as you can see, the determining of when to stop life-sustaining care depends heavily on how hospital managers and staffs comprehend of the legal definition of the total brain dead. To ensure they are adhering to the correct procedures and moral standards, healthcare providers should be knowledgeable on state laws and pertaining to end of life care. The decision must be both legally sound and comply with Arizona's death and end of life care laws, as well as ethically sound, adhering to the principles of autonomy, beneficence, non maleficence, and justice. A suggested resolution that complies with this law could be possibly urgently meeting to discuss the situation with the hospital's ethical committee, following making sure that the patient preferences are clear. This can include advanced directives that may be in place should also be examined. And in regards to the family's disputes, a mediator who is impartial can help to lead the family meetings. And it is important to adhere to the Arizona legislation. The hospital's legal counsel can also be consulted in this scenario. This can help to take ethical standards and the patient's medical prognosis into account. The patient's best interest should always come first, and just furthermore, in maintaining regular contact with the family will be essential. Next slide, please. Additional relevant laws and regulations that pertain to this specific scenario could be healthcare directives, power of attorney, do not resuscitate, or DNRs. These are orders all that are important legal documents that guide end of life care decisions. These laws can vary by state, and it is essential for professionals to be aware and comply with these um, regulations to provide appropriate care for patients. An advance directive, sometimes referred to as a living will, is a legal document that guides medical decisions in the event that a person is unable to make them for themselves. This document can serve as a guide for the family members and medical professionals regarding a patient's preferences for medical treatment, including end of life care. A durable power of attorney, sometimes referred to as a healthcare proxy, is a formal document that gives someone the authority to make decisions for a patient if the patient is unable to do so. Individuals should discuss their desires with their families, members, healthcare proxies, just to certify that their choices are recognized and honored. Another aspect that should be considered is advocacy. Advocacy is the act of representing someone else, seeing them as unique individuals, defending their privacy and dignity, and honoring their decisions. Understanding and adhering to these laws ensures that the patient's wishes are being respected and that healthcare providers are legally protected when making these end of life care decisions. Professionals should also consider that the ethical implications of end of life care decisions, such as ensuring patient autonomy, promoting quality of life, also just staying informed and up to date on both legal and ethical considerations. Providers and administrators can navigate challenging situations like this one with compassion and professionalism. Next slide, please. In this slide, we discuss the interpretation of laws and regulations when making a decision. As a hospital administrator, it is crucial to interpret laws and regulations in a way that upholds patient rights and promotes ethical decision making. Any interaction with the patient and their families requires upholding the highest levels of professionalism and ethics while guaranteeing that patient confidentiality, informed consent, and adherence to care standards. Maintaining the highest standards of care and having a thorough awareness of rules and regulations are essential for navigating ethical and legal issues in healthcare. For instance, the legal and ethical responsibility of healthcare providers stress the importance of maintaining patient confidentiality, ensuring informed consent as well. The administrator can also put these standards of care into practice in this scenario. This would establish guidelines that professionals must follow to ensure practices correspond with both legal and ethical standards. This can lead to improved patient outcomes and also increase the trust in the healthcare system at the hospital. Informed consent, according to clinical ethics academics, is a procedure that includes competence, voluntariness, disclosure, comprehension, and assent, with the last step being the expression of one's choice. For instance, for families representing a patient who is unable to provide consent themselves, understanding the process of informed consent can help them make decisions in the best interest of their loved one. Ethical principles like autonomy, beneficence, non-maleficence, and justice are balanced to ensure holistic decisions considering patient well-being and legal compliance. This strategy would allow the hospital and the providers and administrators to make informed decisions about patient care and also provide accurate interpretations of the law and regulations like the Title 14, Chapter 11, Article 7 of the Arizona State Legislature. Through the guidance of this legislative framework, it can help to ensure that ethical standards are being upheld throughout the care and healthcare procedures for this patient. Next slide, please. In this slide, we will discuss the ethical issues surrounding this case. Uh, this involves autonomy, respecting the patient's wishes, benefits, and acting in the best interest of the patient. In this scenario, it could be the family. Non-maleficence, avoiding harm to the patient from both family and the providers, and justice, fairness in decision making. Ethical considerations in healthcare play a crucial role in guiding providers to make decisions that prioritize the well being and autonomy of the patients. One example is a meta analysis of 95,000 in hospital CPR examples found that only 8% of patients survived for more than a month and just 3% were able to live normal lives that raise ethical concerns. By adhering to principles such as autonomy, beneficence, non-maleficence, and justice, healthcare experts can navigate complex ethical dilemmas with integrity and compassion. These values include honesty, beneficence, fairness, avoiding conflicts of interest, and vowing to do no harm. It is essential for these professionals to continually reflect on these values and also ensure that their actions align with the ethical standards of their profession. The greatest benefit of the patient and legal counsel should come first, as should frequent family interaction for this circumstance. Also, taking these ethical considerations into account, the administrator can successfully execute the recommended solution, guarantee that the patient's desires are honored at every stage of the decision making process. It is important to just prioritize transparency, communication with all the parties involved. This can help to promote a collaborative and ethical approach to resolving this situation. Next slide, please. Implementation of supporting policies and procedures. Um, in this hospital, the main objective that was carried out right away was to consult the ethical committee immediately. This can help to ensure that decisions are in line with moral principles. The committee can also mediate disputes among family members and offer any advice on moral challenges. In the medical ethics committee, interdisciplinary teams consisting of medical, nursing, social service law, and ministry experts resolve numerous ethical concerns. They are essential in helping healthcare professionals and administrators navigate ethical dilemmas. Also, by offering guidance and support, they can help to ensure that patient autonomy, best interests are respected. These committees, for example, create guidelines for organ donation and do not resuscitate orders. They improve the standards of care given to patients toward the end of their lives. They also educate and train medical personnel on ethical concepts and decision making procedures. Effective communication is the foundation of patient centered care, in which healthcare providers work more closely with patients and among themselves to prevent care gaps or errors. By fostering open and honest communication, medical ethics committees can ensure that all stakeholders are involved in the decision making process and that the patient's preferences are respected. This approach can lead to better outcomes for the patient, promote a culture of ethical practice within all healthcare settings. Medical personnel must also provide two medical opinions on palliative sedation with strict informed consent, allowing conscientious objections while respecting patient rights and requiring comprehensive recording and evaluation of diagnostic actions. This can help to adhere to additional rules. Ethics committees and personnel can find a solution for the intubated patient. It can also help staff at all levels so that they are trained in patient-centered care ideas, policies, communication, and cultural understanding. By implementing these policies and processes, it will help to ensure that patients receive the most effective care while also preserving ethical issues at the forefront of healthcare decision making. Next slide, please. Policy and procedures consideration. By establishing clear guidelines and regularly reviewing patient records, healthcare providers can demonstrate their commitment to ethical practices. This can, for example, involve the ethics committees. This can help providers to address complex ethical dilemmas, enhance communication between the team members, and improve patient outcomes. Um, Also, the committees provide oversight and guidance to healthcare professionals. This can ultimately promote a culture of ethical decision making, patient centered care, informed consent policies, help to provide complete patient and family information regarding medical issues and treatment options, as well as the importance of documenting all discussions and decisions in detail. For example, this policy can help a patient who is intubated and incapacitated as well as their family. It helps them to understand the advantages and disadvantages of the procedure so that they can make a well-informed decision regarding their care. Furthermore, just documentation standards are put in place to guarantee that moral judgments are accurately documented and shared within the medical facility. Both patients and healthcare providers can gain from the decision-making processes continued accountability and transparency. Patient advocacy may lower legal risk uh, and litigation increase healthcare workers' job contentment and raise medical standards generally. When there is a dispute within the family, hospital administrators and employees can reach a consensus with the family by maintaining the patient's health as the primary concern, taking these policies and procedures into account. Patient advocacy ultimately serves as a crucial tool for promoting transparency, collaboration, and the procedures used to decide on medical care and advance existing policies. Next slide, please. Ensuring correct procedure follow-up. This entails monitoring and evaluating of policies that will be implemented, also ensuring that compliance is met through audits. Providing support and guidance for staff is another aspect that can help to ensure that these policies are being uh, put in place correctly and accurately and also interpreted uh, well by the medical staff. It is crucial to have a system in place for monitoring and evaluating the implementation of these policies. This can help to ensure they're being followed correctly. Regular evaluations can help that they ensure that policies adhere to ethical and legal standards. They help identify areas that may require improvement in the future. It is important to establish clear communication channels for staff to seek guidance and clarification on any policies they may be confused about. Also, clinical informed consent is a concept that, when applied, it fills in gaps and offers a supportive model of iterative capacity assessment to support clinicians in carrying out their ethical and legal obligations. Uh, Furthermore, regular training sessions can also help keep staff members up to date on best practices and ensure that consistent understanding of protocols. Just implementing a system for feedback and communication can help address any concerns, confusion surrounding informed consent processes. Also, in recent years, patient representation has placed greater emphasis on educating healthcare professionals about cultural competency, compassionate care, and advocating for patients. The organization can establish a culture that puts patient well being first and maintains procedures and ensures that the right procedures are being followed and maintained. And also, administrators can have or conduct regular meetings with medical staff to discuss any other ethical concerns. These explicit policies and procedures, when put in place, can influence decision making and certify that that the patient's best interests are always the top priority. It is important that the patient outcomes um, and greater faith in the healthcare system can result actually from this proactive and improvement approach. Next slide, please. Resources for decision support. The main reasons that the administrator can take this approach or this strategy when deciding uh, how to resolve this scenario. Uh, three things come into place. It's the legal counsel for interpretation of laws, ethics committees for guidance on ethical issues, and support groups for staff dealing with emotional support and emotional impact. Healthcare providers in the United States are legally required to follow conventional ethical principles for ethical medical practice, such as accepting examination and licensure criteria, government regulation of medical records, and court decisions requiring patient record reporting or disclosure. These codes or policies help to ensure that the healthcare providers adhere to high standards of care and maintain the trust of their patients. By upholding ethical principles, organizations can protect the well being of both their staff and patients that they serve. These resources are essential for providing guidance and support for staff members as well as patients. They help to navigate the complexities of policy implementation. Legal counsel can offer clarity on laws and regulations, while ethics committees can provide guidance on ethical dilemmas that may arise. The support groups, of course, can also offer space for staff to discuss process. Um, the emotional impact of their work, ensuring that they have the necessary support to carry out their responsibilities effectively. By using these resources, administrators and organizations can strengthen their policy implementation processes to create a positive and supportive work environment for all of their staff, patients, and hospital. Next slide, please. In this slide, you will find the references. They will provide additional guidance and information discussed in our topics today. If you have any other questions, please feel free to contact me and I can provide additional support. And I just want to thank you all for your time and have a great rest of your day.